All right, welcome to The Boost, conversations with people promoting mental health. And I'm here with Brandon Edwards, the CEO of Unlock Health. Brandon, how are you?
I'm doing great. Thanks for having me.
Awesome. It's been a little while since I've seen you in person, and I'm really looking forward to this conversation.
So you say that now? Yeah.
Say it now. Massive regrets later.
Yeah.
Tomorrow night.
Maybe now.
As we spiral down right now.
That's right.
No, I've got so much respect for you, and it has been a while since we talked, so I'm looking forward to getting into it. And before we do, there's two things we do. There's the virtual hug and the shameless plug. So that sets the table. So the virtual hug is tell us somebody or something you're grateful for today.
Oh, that's a great question, actually. It counted a day lost. I'm not grateful for my wife. We will celebrate our 28th wedding anniversary in a couple weeks. And candidly, I was surprised to find someone that liked me in the first place. So the idea that we're still together after 3 decades is kind of amazing. I think from a work standpoint, I am extremely grateful for my executive team, and Doug and Andrew are fantastic. But Shannon Hooper, who you've interviewed on this show, she and I have been friends and colleagues for 15 years. And I honestly don't know how I would do what I do if we weren't working together.
Yeah, Shannon is brilliant.
She's something else.
She's amazing. And she was a wonderful guest. And so you have a lot to live up to.
Yes. Yeah, lower expectations are helpful.
And for your wife to be with you, that's a long-lasting relationship.
Yes.
That's been beneficial in your life. That's amazing. Good. Do the shameless plug. Tell us what you do, what you're building, what you've built.
Yeah. So I'm the CEO of a company called Unlock Health. Unlock's a little more than 2 years old, but Unlock was created by bringing together a handful of best-of-breed agencies. So my belief was that healthcare providers, broadly defined, right? So hospitals, health systems, behavioral health providers, addiction treatment centers, physician practices, all manner of provider deserve to have access to the kind of comprehensive services and sophistication that are very common in other industries, right? So if we worked in entertainment or sports or financial services, there are firms like ours. There really hasn't been in our corner of the world. And so we built Unlock to serve that purpose. For those clients that want to have a single source partner for all of their growth and marketing, we can do that. For those that just want search engine marketing or digital media or SEO or traditional advertising or whatever it is, obviously we can tailor the solution to the client. But we've built a pretty great company in a couple of years. We're coming up on about just right at $100 million in revenue, far and away the largest firm in the space, about 330 professionals across the country, clients in 49 different states. Sometimes the scale for me is a little intimidating. I think for our clients, what they experience is exactly what I would want them to experience, which is really high quality people with a lot of expertise who care an awful lot about what they're doing, right? This is a business, so we have to make money, but this is very much a mission-driven organization for us.
And you rolled in one of the premier behavioral health marketing firms in the country. Amazing when I learned about that. And then you also have the managed care side of things, which I don't know, in my mind, maybe the most complex piece, although you have the MarTech component too. But talk about the managed care piece and how that fits into the agency stack.
Yeah, so there's to your point, there's kind of 3 distinct parts of our business. There's a technology stack, SaaS-based business basically that supports patient acquisition and retention, some ROI calculation tools, privacy tools, as well as I believe the best health risk assessments in the industry. I think there's 21 of them across a variety of different health conditions, including behavioral health, actually, and substance abuse. A full stack marketing agency that is all the things you'd expect, right? The front end of analytics and research and planning and strategy pulled through every capability: content, traditional advertising and media, digital advertising and media, a really robust creative team, and then all the measurement and optimization that you'd expect. But the managed care side, to your point, I think it's an often overlooked part of growth in organizations. Healthcare is such a peculiar industry, right? Like we view marketing as a cost center when it's a value driver, and we ignore managed care by and large, which actually determines whether or not you make money, and whether these organizations thrive and survive. So I've been involved in where sort of communications or marketing and managed care meet for a long time. It's a very unusual spot in the marketing world. But we decided that what we believed was necessary was to build really a full service managed care consultancy in the confines of Unlock. So that means managed care. This is all for provider organizations as our clients. We don't represent payers, and we'll help them with managed care strategy, their contract negotiations, contract modeling and analytics, benchmarking, price transparency data, all the things that, I know what they do. I don't know how to do them. And then I think importantly for those clients that we do both for, we can take everything that we learn about on the managed care side and port that into the marketing strategy, right? So all of a sudden, you know exactly who your most profitable patients are by payer, by network, by site of care, by service line, by whatever that is. And you can tune your marketing to your managed care strategy. You can have them work synchronously instead of in isolation, which is unfortunately the way it works in most provider organizations.
Yeah. How did you get to that vision? Like, well, first off, how did you get into healthcare generally? And then how did you pull that vision together?
Yeah, so it's a bit of a story, and I'll tell it as quick as I'm capable of.
We got time.
So I got into healthcare by accident, the way most things in my life have happened. I came out of college running political campaigns. Did that for a few years. Very different enterprise than it is today. It was actually very civil. You'd be friends with people on the other side. I think we all probably miss that on some level. I transitioned into the agency world and was doing really the sort of grassroots public affairs, crisis communications work. And I got married, and the agency was cutting salaries and downsizing. And I thought, safety happens in the corporate world. Right? But I think there was, especially in late 90s, early 2000s, there was more truth to that than not.
Yeah.
And I applied for a job at Tenet Healthcare to work in crisis communications, because crisis, I do think, is one of those skill sets that ports pretty well, sort of industry to industry. And they were unwise enough to hire me because I'd be truly not qualified, right? Like I reported to someone who reported to someone who reported to the general counsel. And they gave me a lot of responsibility quickly, which I'm grateful for. I think I was 26, about to be 27 at the time. And worked there for 5 years, did 3 years in crisis communications, kind of grew my remit from the Western Division to the whole country. And then they asked me to step into a group called Corporate Strategy and Ventures. So I reported to actually a guy named Paul Kusro, who'd be a great guest for your show.
Okay.
He has a new book out. Actually, he's the former CEO of Amidst. He was at the time running Corporate Strategy and Ventures for Tenet. That group eventually rolled up to the CFO, but it rolled up to Paul at the time, who is a great guy and an amazing leader. And I'm lucky that he's a friend and agreed to hire me, actually. And I worked for him for 2 years while I was finishing my MBA.
Yeah.
And then there was that pivotal moment where I'm coming out of Tenet thinking, either I am now going to leave healthcare and go back to being something else, or I'm going to go all in and be a healthcare person. And this was late 2001, early 2002. And I remember it came down to an agency job to build a healthcare practice or a public affairs role for Disneyland. And my kids, like, it wasn't even close, right? Like, you got to go to Disneyland. But my wife kind of looked at me. We lived in Santa Barbara at the time. She looked at me and she said, if you take the agency job, can we stay here? And I said, yeah. And she said, then let's do that. And I mean, honestly, that was about the extent of the career strategy that was involved. 100% best decision I made my whole life. Not because that agency was perfect. I learned a lot, but I came in as a part owner, helped to build a healthcare practice, and then eventually purchased that practice to form what was my last company, my last agency. So, and from there it was healthcare, all healthcare all the time.
Yeah. My dad was a pastor, and he one time had 2 job opportunities. One was in Northern California in the Valley, and the other was Hawaii. And all 4 of the kids who were like,
not close.
we know what you should do, Dad.
Yeah.
And he did not do what we wanted him to do.
No,
but
I understand.
Yeah. He got to make the decision.
Growing up in Hawaii would have actually been really interesting for you. We've spent a fair amount of time there as a family and as adults, as a married couple. And it is a different experience. It's I would argue, one of the few places in America where people that look like us understand what it's like to be people that don't look like us in the rest of the country. And I mean, I'm not saying it's good or bad. I just think it's a very interesting and different learning experience for people there.
Oh, that's fascinating. I actually I've never been.
Oh, wow.
But I don't know if is Howley, is that the term?
It's the term.
Okay.
Yeah, it's not a compliment. Yeah.
It's not a compliment. Yeah.
It means about what you'd expect it to mean in reverse if they were to say that about someone else. Yeah. And those kids, I don't know if it's as bad as it used to be, but those kids do get picked on. And, the social hierarchy is Native Hawaiian, Asian, and then white. And that's a different thing, right, than you experience in almost any other part of the country.
Yeah. Fascinating. So you took the agency job. You stayed close to home for a while, and then you evolved that and grew that. I don't know if you all know this listening in, but I worked for you and worked for Shannon directly, but at your company.
We say with, but yeah.
Oh yeah,
yeah. We always work with people. People don't work for us.
That feels nice. That is good. It did feel like I was working with you and involved in all manner of things. One of which was it was my first taste of helping to run a conference or an event. We had this summit that we would do, and I got to sell sponsorships into that. And that was like the first Lego block of me getting into events.
I wouldn't have connected that.
With selling sponsorships into that event. And when the founder of the Mental Health Marketing Conference came to me and said, "Hey, would you be willing to help out in sponsorships and speakers?" I was like, "Oh, I'm barely qualified to do that." Yes. Let me totally.
I've done that hundreds of times, at least once.
I've made hundreds of unsuccessful calls and 6 very successful ones.
Yep.
What is your, when you look at yourself, like pulling Unlock together and combining companies, like what is your sort of genius in that? Because, and I'm not like trying to overtly give you a compliment, but I always felt like you could see like down toward the end game, like you were playing chess, like you can play checkers in business sometimes, and you were playing chess with the thoughtfulness and the need to keep the integrity in the decisions, which meant this forecast and foresight into what were the potential things that could happen. And then for you to roll up Unlock, and it's incredible. Like how do you do that? What do you draw on? Are you a connector or a problem solver or something else?
It's a great question, because when we created the company, Shannon and I together created the company. I remember we brought in a team that did like executive assessments, right, of all of us and all the people coming in from all the different companies. And there was this great line in one of the reports that said, Brandon lacks the ability to think about second order effects. And I'm like, well, that's probably true, because I don't know what that is. Right? So, Shannon explained it to me, which I was the question. Like, true statement, I don't know what that is.
There's more than one effect?
Yeah, there are. Apparently, there's 3 at least.
Oh, geez.
I had no idea. So, and I don't know. I mean, I think, look, on some level, you're being kind. I do think CEOs get disproportionate credit and blame for success. I think probably the blame's more deserved than the credit a lot of times. I think the older I get, I'm 54, about to be 55 now, and I think my skill set comes down to a couple things, right? I think one, I believe I'm a pretty decent judge of talent. I think if we look at our executive teams I've built in a couple places and leadership teams in general, I think I can tell the difference between good and great.
For sure.
Certainly not batting 1,000, but you go to the Hall of Fame for batting 300, and I think I do better than that. I think I have a decent sense of vision, I guess maybe is the word for it, but you're kind of seeing what's missing or what could be. And doesn't always mean I know the best way to get there, but I think I can see the destination better than I can see the journey, if that makes sense. Mm-hmm. And I think genetically just blessed with this sense of optimism, right? Like for me, the glass is always half full. I think an abundance mindset in life instead of a scarcity mindset is extraordinarily healthy. I've tried to teach that to my kids. Sometimes they teach me that in return.
Yeah.
And I think it's really those two things. Like I was just talking to one of our senior leaders the other day, and I said, "You realize I'm the only person in the company that everyone that reports to me is better at everything that they do than I am." Right? Like if you're a manager, generally you're managing people where you're the expert and people come to you for advice and mentorship and growth. Nobody does that, I promise. I hire really exceptional people who, my chief people officer is infinitely better at HR than I will ever be. Same with my CFO, same with Shannon, same, you name it. At some point, you're more like a general manager or head coach than you are anything else, right? And I think it's vision, it's motivation, and it's talent assessment, ultimately.
Wow. Yeah, I agree. You brought some of the smartest, brightest, nicest, people together to do amazing work and incredible campaigns, when I was working there. And I align with you on I love to spend my time on the future vision, and you can kind of vision cast and stuff, or there's actually real work to be done there to keep the ship going in the right direction.
For sure, yeah.
And the more I build different things, the more I find myself enjoying my time there, not always knowing what are the miles in between here or there, but certainly knowing, oh yeah, this is the wave I want to ride.
And I think it can be frustrating when you're in the middle of it, right? Because you keep thinking that answer is elusive, right? It feels like it's right there. I mean, I think a lot of times we approach things with the wrong question, is like, what do we want to do? And I think often the best advice is to approach on where the gaps are in the market. What is it that people actually need that isn't being met? And what do they need that they may not even recognize they need? Steve Jobs, I can't do the verbatim quote, but Steve Jobs has some great quote when they were talking about the iPod. He's like, we don't do focus groups because how do you ask people whether they want something they have no idea can exist? Mm-hmm. And it's like, there's some real truth to that, right? Is you have to, and now that doesn't mean you're always going to be right. When you're trying to figure out what people need and they don't recognize it, sometimes they do recognize it and they just didn't want it. That's just the reality of business, is you're going to miss the mark sometimes a little bit. But I also think you just have to be comfortable with sort of calculated failure, right? Like, I don't think healthcare is a move fast and break things kind of industry.
Sure. Yeah.
But I think you have to be okay being wrong and learning from that and then pivoting quickly, right? You don't want to fall in love with your own cooking too much.
Mm-hmm. Okay. This feels like a good spot. We're going to take a quick break. We want to come back. I want to talk about the book you have coming out. I want to talk about payers. That's one exciting reason I have you on this show, is you have such a perspective on that, and more with Brandon Edwards right after this.
Hey, this is Steve Turney, and I want to invite you to a webinar on how to write a value proposition in mental health care. So when we're marketing mental health services or even mental health tech, we might get a little bit wary of sales-driven messaging. Maybe we're afraid of alienating our potential clients or losing that empathetic approach that we normally like to provide. And that makes sense, because messaging mental health care can be really complex. It requires us to reduce industry jargon, but we want to build trust and credibility while still creating that urgency to buy. So it takes a balance, and we need to be effective at simplifying our core niche into a powerful value proposition. So I would encourage you to join Greg Davis of Azola Creative on Wednesday, May 14 at 2 p.m. Eastern Time for a 100% free online value proposition workshop. We will have the registration link in our notes, but please join us and hear from Greg Davis of Azola Creative on Wednesday, May 14 at 2 p.m. Eastern Standard Time. This is Greg's webinar, but I will be in the audience listening in as well. It's a great topic. I hope you can join us too.
All right, we're back with more from Brandon Edwards. And one thing I know Unlock does extremely well is create this pillar type content and valuable content that really serves. I mean, from my perspective, I watch the behavioral health side of things and mental health side of things, but you all turn out high value content and research, and you have surveys and a book coming out. Talk about the book first.
We do. There's a book coming out just before the 4th of July weekend called Authentic Healthcare Marketing in the Post-Truth Era. And every one of those words needs some level of explanation. The post-truth era is a term that's been around for about 20 years. I think on some level we all recognize that we're in the post-truth era. And so we now say things in our conversations like my truth, right? And it's like, I'm kind of a big T truth guy, like I think there's such a thing as real truth in a lot of ways.
Yeah.
But in this era, the definition of truth has become almost tribal, right? So I can believe something, and I can find lots of people in online communities who believe the same thing. I can get my news from a source that reinforces that I'm right about everything that I believe. And facts are significantly less important in a lot of ways to a good chunk of the population. And on some level, we can recognize this affects politics and faith in institutions and a number of different things. But here's the problem for us as healthcare providers. We work generally for organizations that are viewed as institutions in an era that distrusts institutions. And we market through experts, generally in white coats, in an era that distrusts experts, particularly those in white coats. And so how do you fulfill your mission as a healthcare provider in a time and place when your marketing may not be tuned to the very specific cultural moment that we're having, right? And I think, look, there's a political element to this. There's a financial system element to this. There's a lot of aspects of it. So this notion of kind of authentic healthcare marketing is a concept that we're really trying to put forward of how do you help healthcare organizations show up as their authentic selves, consistent with their mission, but in a way that tunes their message, their messenger, and their channel to reach audiences that they're not reaching. So as an example, I would ask marketers, tell me what percentage of your marketing spend goes into Truth Social or Blue Sky. Now, I don't use either of those, right? I actually am not a terribly partisan person. But I think the answer usually is none. I mean, they're reluctant to wade into X, which frankly has become a much more sort of partisan or tribal platform over the years. Weirdly, right? Started out as an extremely ultra progressive platform, 100 years ago, and is now exactly the opposite of that. You don't see that a lot in the evolution of media channels. And so certainly that's not in any way a comprehensive part of what the book is, but I think, the book is really helping people to recognize the problem, to think differently about message, messenger, and channel, to think differently about how they plan, and to frankly, to get past our own biases about who we agree with and the things that we believe. There's a couple stats I'll throw at you quickly, because they always get a little bit of a chuckle. About 16% of Americans believe that the Earth is flat. 10% of Americans believe that the moon landing was faked. For millennials, that number's triple. 35% of millennials believe that the Earth is flat. That the moon landing was faked, and about similar percentage, about 35% believe that the Earth is flat.
Really?
And we can look at that and say, okay, that's sort of goofy on some level. But also, it doesn't matter whether it's real, and it doesn't matter whether we believe it or not. It means that there's a huge cohort of people that we are not reaching with our messaging unless we show up in a different way in different places. And I'm not saying the authenticity part of it is, we're not going to say things that are untrue. Healthcare providers should be scientifically rooted and act with integrity, but we have to show up in places that we're not comfortable, and we have to address topics we're not comfortable with. I think we could do a whole episode on vaccines. We're not going to wade too much into that. Prime example, though, right, is there's a lot of myth out there that is being propagated as fact, and if we just brush it off and say those people are stupid, they're not. They may believe things that aren't scientifically true. But if we just ignore them, then they're not going to receive access to care that they need. That is our mission as healthcare providers.
So this is, you'll never run a campaign that says like our healthcare is as good as the world is flat, But there is a fascinating related thing, which is when you look in the mirror, you prefer the face that you see. If I held up two pictures of you and one was reversed, you would like the one that you see in the mirror. I would prefer the one I see right now when I look at you. And the only difference is the exposure that you get to that certain face. And so
great. That's actually
it's a wild metaphor or analogy for one of the secrets to good marketing is simply to do it over and over and over and over again. You see the Coca-Cola effect. Like if you start to look for the Coca-Cola brand, you'll see it at every gas station you pass. Every fast food joint has a sign, and you see it everywhere. It's ubiquitous. And so messaging and propaganda is incredibly powerful simply by being there.
And I think let's all agree that what we do in healthcare is way more important than sugar water. right? And yet, Coca-Cola is the most aggressive marketer, I think, on the planet. I think they spend north of $500 million on advertising every year. It's extraordinarily effective, right? They've built incredible market share. There's a certain flywheel effect that comes from that.
Yep.
But, it certainly doesn't look, feel, and sound the way it did 5 years ago or 10 years ago or 20 years ago.
Yeah.
Or when the company was founded with cocaine and you drink. So,
yeah, it's true. And that's part of our mission at the Mental Health Marketing Conference is simply, hey, there's some smart consumer marketing and better ways to build brands that, healthcare generally has left behavioral health out in the field, the last silo to come in to the continuum of care. And we're suddenly starting to realize how important it is or what the costs can be. It's still not, driving profit margin like hip replacement or something like that. But there's a lot to be said for the miles we still have to go. And your organization, Unlock, knows this probably better than most. Like, you've done the research and the surveys on brand perspective in the space and marketing ROI. Share some of those insights that you all have gleaned.
Yeah, so we've done a survey of executives in the behavioral health space for a number of years. We just came out of the field with our most recent survey, and there's a lot to unpack in it. But I'll give you kind of 3 data points that I think are interesting. One is only 19% of behavioral health executives say that they're focused on brand building, which said another way is 4 out of 5 aren't, right? So the old Trident ad, right? A 4 out of 5 dentists surveyed, 4 out of 5 behavioral health executives surveyed are not focused on brand building. I would argue in behavioral health is one of the areas that brand building is actually the most essential. So granted, it can be more difficult to quantify ROI and impact from that, but I think we all understand on some level that strong brands retain customers or patients in our case, and weak brands are much less likely to. Second fact I'll give you is 63% of the executives surveyed said that they don't know if they're addressing the right audiences. So almost 2/3 of executives are saying they're not sure if their marketing is hitting the right people, compounded by 79%. So again, 4 out of 5 say that they can't measure ROI from their marketing. Now they can. The technology exists. It's actually not nearly as complex as it used to be, and it is not nearly as complex in a behavioral health organization as it is in, say, something like a hospital, right? That has multiple services. Maybe it's been around for 100 years. Its attribution can be a little bit different in that. So again, sort of think about 4 out of 5 don't focus on brand, 4 out of 5 say they can't measure ROI, and 2 out of 3 aren't sure they're hitting the right audiences. These are all fixable problems. These are all addressable problems with the right marketer inside organizations and the right marketing partner to help navigate that.
Those are extreme gaps in marketing. And why is it? Why is behavioral health so behind in that? Like, what's the perspective of your firm?
I think we could speculate about a lot of things. I think part of it is there has not been a lot of money in it historically, right? So to your point, orthopedic and oncology and cardiology marketing is pretty sophisticated. And, one of the holy trinity of ROI, right, for healthcare organizations.
Yeah.
Still lots of room to grow. I do think, the sort of the line of like, healthcare marketing trails the rest of the consumer marketing world by 10 years. I think that gap has narrowed a lot. I think it's become substantially more sophisticated, substantially more analytically driven, and substantially more focused on ROI as it should be. But I think when you look at those service lines or those areas like behavioral, where maybe the profit margin hasn't been as significant in the past, maybe in some organizations it was viewed as more of a mission-driven activity. Maybe, maybe insurance coverage mattered less in the past. Again, I'm kind of speculating on it. I don't think any of those are good reasons that's still that way. I think there are opportunities to up-level. I do hear a lot from people in the industry like, we don't worry about that because we're a mission-driven organization. I say, I don't understand the tension in that at all. Like, being able to reach people that ensure you're profitable mean you can serve a lot of people.
Yeah.
Right. That reinforces your mission. That doesn't run counter to your mission. So just because you can attract the most profitable patients doesn't mean you have to. Doesn't mean you have to only accept them, but it gives you the muscle to be able to do that and to build those brands.
I'm so glad you went there. We're starting to see and have seen the private equity, wave come and go and come again in the space. But to follow the money, one of your areas of expertise is on the payer side, and there's always so much tension in the behavioral health, talk therapy, super bill, like all of the negotiation that goes into that. And you have such a perspective on it. Could you share just what's your read on the landscape at a high level between payers and health insurance companies and people trying to provide mental health care and addiction treatment services right now?
Yeah, I mean, I think, so let's start with what we would all assume is happening, right? I think any reasonable person looking at the current landscape in America would say health insurance companies must be really leaning in to support access to behavioral health services in what is either a crisis or a near crisis in America, right? I mean, record levels of anxiety and depression, record levels, and all of the ensuing impacts, right? The human impacts, but also the business and financial impacts, absenteeism, presenteeism, all of those kinds of issues. You would think that what payers are saying is, let's take some money from other areas maybe and really boost what we're doing in behavioral health. Let's open up access. Let's support providers who are trying to provide services to underserved communities in different areas. Yeah, so none of that's happening. I think there was a brief moment coming out of COVID when your telehealth spiked.
Yes.
That you saw, I would say, more, maybe still not adequate, but more payer support around behavioral health, particularly in lower cost settings like telehealth.
Okay.
That's all done now. I think when you look, you may have seen it. We're talking on Friday, April 18th. Yesterday, United Healthcare stock dropped 20% because they missed earnings by 9 cents on the quarter. 20% from a 9-cent miss, right? I don't believe that there is any reasonable person that would look at that dynamic and say, what United Healthcare, the lesson they learned from this is that they need to be more consumer-centric and pay providers more. That's a hard no, right? These payer organizations are being much more aggressive with providers, even in an era of inflation and the impact of tariffs on inflation and wage inflation, all those things we're experiencing. Yeah. They're seeking rate cuts in a lot of cases. They're reducing networks. They're reducing access. They're reducing payment. They're making it more challenging for people to get care that they need. And I think that's unconscionable generally. I think it is particularly unconscionable in behavioral health. And I don't think I've even shared this with you. My middle son, who's 25 now, is finishing his master's in clinical psychology. Oh, he's going to be a therapist. Yeah.
Oh, that's awesome.
And he has spent the last year at a place in Denver called Tennyson, where he works with really vulnerable adolescents and teens.
That's great.
ADHD, autism. A lot of them are in foster care. Before that, he worked in the locked psychiatric unit at UPMC Psych Hospital in college for a year. He's got an amazing experience. He is truly an exceptional guy. And he largely got into this, money aside, because there was a very small percentage of therapists under 40 that are men. And he felt like he benefited from that when he was younger. And he wanted to be there for people like him that maybe, especially younger guys who would identify with a male therapist. There's no rational financial reason for him to go into this, right? He could do so much better financially doing lots of other things, but he cares about this. And I think a lot of people in our industry do. I think they're driven by that.
That's beautiful. Yeah. I am optimistic about as we move through the kind of the population pyramid right now is very tight. And Gen X, like people my age, are the perfect age to be a clinician, and there's just not enough of us. And that is going to change. So it literally gives me chills to hear your son is, choosing that path. And I think, there is still stigma to search, and find the care we need or to admit it. Sometimes our profession doubles that down on us. If you're a physician, are you going to say, "Oh, I've had severe mental health challenges lately, and please give me my licensure again"? It's like there's incentives around us to have stigma that we need to still overcome. But by and large, this movement is probably not going to come from the payers. It's going to come from people like your son stepping up and saying, "This helped me. I've seen my friends go through this, and I'm going to choose this path," and that's encouraging.
I think to your point, I want to be hopeful that health insurance companies ultimately reflect the wishes of their customers, which are employers and to a certain extent individuals. But but really, if you look at increasingly, the health plans, the payers business is really about serving government entities, right? I mean, United's a great example. 74% of the revenue comes from government programs. It's our tax dollars. It's Medicare Advantage and it's managed Medicaid by and large, and to a lesser extent the exchanges, right? The ACA population. And in all three of those cases, generally speaking, healthcare providers lose money serving those patients. The only money we make consistently is serving the commercially insured, which is a shrinking part of the population. So I want to believe that's going to get better. I do think, we saw some benefits in the ACA in terms of behavioral health parity and a number of other things, but there's a lot of work to be done there, right? Because you can meet all the requirements on paper if you're a health plan without actually meeting the requirements.
And this is where you can go 10 miles deep, and I'm like in my water wings in the shallow end of the pool here. But why is the commercially insured percentage of the population shrinking? Like, what's the dynamic?
Yeah, just demographics in the United States, right? So if you think about, I think it's 7,000 or 8,000 people a day age into Medicare, and so commercial insurance is provided to fewer and fewer people every year.
Okay.
And this is exacerbated now by restrictions on immigration. Again, not making a political statement, just a demographic statement that, with immigration restrictions, there's fewer people, younger people immigrating to the United States who might eventually then take jobs and become commercially insured. The other is it's become hideously expensive for employers. Right? I mean, you look at the line item of what that represents for many employers. And even then, I would say that's commercial insurance does not provide the kind of value that it used to provide, right? So we looked at, there's a stat that just came out, the increase in denials for care that's already provided from 2022 to 2023, commercial insurance denials increased 20% in 1 year. So that's care that's already been provided that the payer's just saying we're not paying for it, right? In Medicare Advantage, so for that population, denials increased 55% year over year. So all of a sudden people say people really like Medicare Advantage less than they used to. I'm like, yeah, I wonder why. Because you have coverage and you're going to the doctor and the patient is largely protected from that in those programs, but the provider isn't. So they've done all the work and then didn't get paid for it because that care was denied.
Wild. Where do you, in the midst of all of this, find your kind of wellspring of optimism? You're an optimist, and it gets kind of dark. And like you get into the real like this, it's like, we've seen some ugly things. It's like, where do you pull from to like find where's your optimism come from?
Yeah, I mean, I think, I guess a part of it is, I think things are rarely as good or bad as they seem in the moment.
Okay.
And I would say I used to probably have more hubris about like things are going really well. They're always going to be great, right? Things are going to be perfect. And then you realize like, the other side's also true, right? Like and that's why I say really as good or bad as they are in the moment. Mm-hmm. I mean, I guess my optimism comes from a couple places, right? I think one is the fixes to this are within our collective power, right? Maybe there's too much control over the system in a few hands on the health insurance side. Maybe the government has been in general too sort of payer friendly and not friendly enough on the provider side. We can talk about special interests and 1,000 other things, but I believe we're in sort of a season. I'd like to think that there's real opportunity to come out of that. I think deep down, I do believe people are good. Despite all evidence to the contrary. I think most people want to do the right thing. I think most people are genuinely sort of wired right. And so I think like we may do the wrong things for the right reasons, but I think over time there's an opportunity to help sort of course correct on some of those things. Mm-hmm. I do think ultimately we just have a healthcare system that is way too centered around the needs, desires, and priorities of health insurance companies, and not nearly enough around healthcare providers ultimately.
Mm-hmm. My brother's about, 8 or 9 years ahead of me. and he in life, and he's always dropping these wisdom dimes, and he says, evil and ignorance have the same consequence oftentimes. It's like sometimes you just don't know, and then sometimes you're willfully like, chasing that.
Yeah.
But the belief in generally people being good and being our compatriots in this, being in the work together, that's an interesting point. And yeah, we can get not just skeptical, but kind of sometimes jaded, about that, I guess. But we don't necessarily have to go there.
Look, I think about it from a healthcare provider standpoint. So, we're mostly talking to executives and marketers in this, but every one of those people work day to day with people who actually provide care, right?
Mm-hmm.
To choose to spend your life meeting people at the moment that they're their most vulnerable, they're having their most difficulty, and being in some ways a repository for a lot of that,
Yeah.
I find truly remarkable. Like, I don't know if I'm made that way. I want people to tell me they're doing fine so I don't have to help them fix whatever it is. But I think like that's part of what gives me the optimism. Like we we're talking about my son a minute ago, like how does that not make you optimistic that here's someone who benefited from something who says, I want to spend my life doing that for other people? Like that makes me incredibly proud of him as a human, but I also just think it makes me hopeful in general because I know he's not the only one. There's a lot of people like that.
There's a lot of people. You and I both lived what has been called agency life. There's this term in marketing firms, it's this extra kind of, you get in it all together, you put in long hours, you go to the pitch, you take the red eye flight. There's something about, working at a creative firm that is a little bit extra, and I draw a sense of optimism from when I went to a licensed professional counselor, did a lot of the work, a lot of the junk, cleared it out. Not that I'm perfect in any sense of the word or that I'm done with that work, but that a new definition of agency life, meaning, yes, there are things out there that come into our life that are beyond our control sometimes, but it seems like for the most part in my life, a lot of what I was doing to myself.
Oh, for sure.
I was taxing myself 4 times more than the government was taxing me. I was, not taking care of my health the way I could mentally and physically. And to start to do that internal work for me gives me this concept of agency life where it's, one, knowing what you can control and what you can't and not crossing those wires. And then 2, just focusing on making progress toward what you can control and seeing the ripple effects and the compounded interest that you can make happen in your own life.
Yeah, I know when Shannon was on this, she talked a lot about her focus on the Stoics.
Yeah.
And I mean, that's really what you're describing, right? Like we don't call it that much because not everybody reads Marcus Aurelius in the original freaking Latin or whatever Shannon does.
I know one for sure.
Exactly. I mean, I think that, so I did a very similar journey to yours. I hired someone in 2019 that I referred to as an executive coach for a long time who was 100% a therapist and works largely with CEOs, professional athletes, and musicians. Like what an interesting cohort of humans that he deals with.
Are you the professional athlete?
Yeah, sadly, no. I'm not that good at anything.
Yeah.
But he, so I've worked with him since 2019 because we're selling our company, and a lot of people sort of warned me at the time, like, oh, you're going to go from being very important to not being very important. And I remember at the time thinking, like, that's not a thing. Like, that's not me. It's 100%. That's anybody, right? Because your life is changing. And to your point, so much of what we do to ourselves, right? My definition of success, my overwhelming desire for control in everything, right? And it's not healthy. And I know it's not healthy, but if you can't see it, it's just part of your personality on some level, right? So I think that's it. I think that's a good insight. Like doing the work is helpful. It doesn't make us perfect, but it makes us better, over a period of time. And I do think it's possible to have a very healthy relationship with work. I have not always had that. I don't always have that on Tuesday, right? But but I think sort of working toward that, and to your point, controlling what you can control, and being at peace with the outcome of those things that you can't. You do your best. Years ago, I had a friend say to me, like, I figured out why I'm so freaked out in my executive level job. And I said, what? And they said, I'm afraid that people are going to see me as a failure. And I said, well, this is an important question. Are you afraid of failing? Or are you afraid of being seen as a failure? And they said, oh no, I'm not afraid of failing. I know that's going to happen, but I'm afraid of being seen as a failure. And they said, don't you think about that? And I said, honest to God, never. I don't, not because I don't fail. I fail plenty. I just am unconcerned about how others view me in that. Like I'm going to be way harsher critic of myself than anybody else is going to be a critic of me.
I'm recently leaning into this work by Alfred Adler, one of the like Jungian, like young Freud, Adler along those times. And there's this great book called The Courage to be Disliked, and essentially where the freedom in life comes from this ability to be disliked. Not that you're trying, that's a whole nother thing. You're not trying to be disliked, but the fact that you can be disliked. And when I went to a counselor, it was under the guise of career guidance for sure. I was like, what's the sales?
Where's this what guys do? Yeah.
But I wasn't going to mention it because I didn't clear it with you and I only subconsciously thought it. But when you talked about having an executive coach, and I knew what you really meant back then.
Yeah.
You were one of two people in my life that, without maybe you even knowing it, encouraged me and got me into a counselor.
Yeah.
Because I thought, well, he's doing it.
Yeah.
Honestly.
Oh.
There's you and
one
other CEO who actually gave me the word of mouth referral to the person I went and saw. But yeah, thank you for doing that. Like for just speaking it in your own way out into the
world. It
world.
was purely selfish on my end. So I'm glad it had the outcome, but it was funny. It was probably 2 years of working with this guy when we were talking about something one day. And I said, well, at some point we're in therapy. And he goes, buddy, I have news for you. You've been in therapy for 2 years. And I'm like, I think there is a part, of therapy, at least for me, and maybe this has been true for you as well, is like, I needed to be sure he was smarter than I was. Like I needed to be sure I couldn't manipulate him. I'm not saying like deliberately, just, that what do we do in marketing? Marketing is I hope, a benevolent form of manipulation, right? We're trying to help people get what they really need, even though they don't always know what they really need.
Yeah.
And it's really easy to have that become a part of who you are, right? And just manipulating people in situations, and you try to convince yourself it's always for good, and hopefully it is. But I thought I have to be sure I can't manipulate him. And it took me maybe 3 or 4 appointments to figure out like, oh no, he has my number.
Found the right.
And some
good.
Yeah, he is so much smarter than I am. That the dislike comment, you got me thinking this. I don't know. I didn't plan to talk about Steve Jobs a lot, but I have no idea if this was actually said, but there's a scene in the Michael Fassbender version of Steve Jobs movie where one of his peers says, why do you work so hard at being disliked? And he said, I don't work hard at being disliked. I'm just ambivalent as to whether or not I'm disliked.
Totally.
And I thought, there is a certain power. Now there's plenty of things Steve Jobs did that I think we could all look at and say that way if he wasn't great. But that is extraordinarily healthy, I think. And it has to be for a leader. If you're looking over your shoulder all the time, wondering like this job is hard enough, without wondering whether everybody likes you and agrees with you or not.
Yeah.
That's a surefire way to get paralyzed, I think. And maybe just in life generally, but certainly if you're a leader of any kind of group of people or organization.
Yeah. And our incentives get mixed all up into it. But I've seen so many employees on the employee level miss opportunities because of the inability or the lack of courage to go into a hard conversation. So we do all these other things to shapeshift around it. And
we wait to be invited a lot.
Yeah.
We'll wait to be invited. Yeah. It's like, don't wait to be invited. Raise your hand. Right.
Well, I could keep talking with you. We're going to wrap. But before we do this thing called the Boost, which is there something in your life, that's kind of working for you right now in terms of your own mental health care, your own coaching, anything you're doing to care for yourself that's, I don't know, you're working on?
Yeah, so this is newer for me. Actually, it's weird. Now that I think about it, it synchronizes with just about the time that I hired my coach / therapist. And I started doing yoga, and partly because I've been, 6 million miles on an airplane in my life, and it does wear you down after a while. But pretty much every day, go to, and what's really cool about it, so I go to this place called Fahrenheit Yoga in 12 South, and the woman that owns it is very open that she's in recovery, and they actually do yoga sessions specifically for people in recovery, which is really cool. Actually, they would be phenomenal people for you to have on. Talk about the authenticity. They are incredibly authentic people. It's two sisters that own it. But I started that about 6 years ago, and it is maybe the only moment of the week other than when I'm in church that I feel like I am not thinking about anything else. you do for the first 5 minutes, because that's just us, right? Our brains are going a mile a minute, but it's hot. It's there's a rhythm to it, right? This is thousands of years old for a reason, and I've gotten tremendous sort of like physical and mental benefits out of it, I think.
Awesome.
So I know that's not for everybody, right? I think, but I do think it's sort of a good combination of exercise and just sort of cleansing, getting the inside on the outside.
Fahrenheit yoga?
Fahrenheit yoga.
Oh, Fahrenheit.
Yeah, like hot. Fahrenheit.
Okay.
Fahrenheit yoga. It's in 12 South. It really is an exceptional place.
Nice. I go to a place called Small World Yoga. Have you heard of that?
No.
Okay. It's a nonprofit, but it's a hot yoga place. I think they probably do not hot yoga too, but that's what I go there for. And it's so great because you can't be in your head. I mean, it's just
just take a break, right?
Right.
Yeah, you gotta get out of there, right? Yeah, it's the world's good on the outside.
Yeah. Well, Brandon, thanks so much for being on the show. It's really cool to have you on.
My pleasure.
And go tell Shannon how smart she is.
Yeah,
she knows.
But I'll remind her. Yeah. No, I appreciate it. It's kind of you to have me on. I hope it was a good session for everybody.
Thanks so much. It's great.
Yeah.
All right. Till next time.